An interview with general physician Dr. What inspired you to become a physician, and why did you choose to specialize in general medicine?
I have always been passionate about helping people, and I knew from a young age that I wanted to pursue a career in healthcare. General medicine appealed to me because it provides the opportunity to work with patients of all ages and backgrounds, and to address a wide range of medical concerns.
How do you keep up to date with the latest medical research and advancements in your field?
I regularly attend medical conferences and read professional journals to stay current with the latest research and advancements in general medicine. I also collaborate with other healthcare professionals and participate in continuing education courses to further my knowledge and skills.
Can you describe your approach to patient care and how you prioritize patient needs and concerns?
My approach to patient care is centered on building strong, trusting relationships with my patients. I prioritize their needs and concerns by taking the time to listen to them, understanding their medical history and lifestyle factors, and developing a personalized treatment plan that addresses their unique needs and preferences.
How do you work with other healthcare professionals, such as nurses and specialists, to provide comprehensive patient care?
I believe in a team-based approach to healthcare, and I work closely with other healthcare professionals to provide comprehensive patient care. This involves regular communication and collaboration to ensure that patients receive coordinated, high-quality care.
Can you discuss a challenging case you encountered and how you managed it?
One challenging case I encountered involved a patient with a rare genetic disorder that presented with a range of complex symptoms. I worked closely with specialists in several different fields to develop a comprehensive treatment plan that addressed the patient's unique needs and provided ongoing support and monitoring.
How do you ensure that patients understand their medical conditions and treatment options?
I believe in taking a patient-centered approach to healthcare, which involves explaining medical conditions and treatment options in clear, easy-to-understand language. I also encourage patients to ask questions and provide educational resources to help them better understand their healthcare.
Can you describe a time when you had to deliver difficult news to a patient and how you handled the situation?
Delivering difficult news to patients is never easy, but it's an important part of being a physician. I approach these situations with empathy, compassion, and honesty, taking the time to listen to the patient's concerns and providing emotional support throughout the process.
How do you promote preventative care and encourage patients to adopt healthy lifestyle habits?
I believe that prevention is key to maintaining good health, and I work with patients to develop personalized prevention plans that include regular screenings, vaccinations, and lifestyle modifications such as diet and exercise. I also provide education and resources to help patients make informed decisions about their health.
How do you approach patients who may be resistant to medical advice or treatment recommendations?
Building trust and rapport with patients is essential in overcoming resistance to medical advice or treatment recommendations. I take the time to listen to patients' concerns, understand their motivations and barriers, and provide education and support to help them make informed decisions about their healthcare.
Can you describe a time when you went above and beyond to provide compassionate care to a patient?
One example that comes to mind is a patient who was struggling with a chronic illness and feeling isolated and depressed. I took the time to listen to her concerns, provide emotional support, and connect her with community resources and support groups. I also made myself available for follow-up appointments and phone calls to provide ongoing support and encouragement.
Can I ask some question about general health?
Sure, I love to answer and try to explain.
What are some common health concerns that people should be aware of?
Some common health concerns include heart disease, diabetes, high blood pressure, obesity, and mental health conditions such as anxiety and depression.
How can people maintain good physical health?
Maintaining good physical health involves a combination of regular exercise, a healthy diet, sufficient sleep, stress management, and avoiding harmful habits such as smoking and excessive alcohol consumption.
What are some key preventative measures that people can take to avoid getting sick?
Key preventative measures include getting vaccinated, washing your hands regularly, staying away from sick people, and practicing safe sex.
What are some common mental health conditions, and how can people manage them?
Common mental health conditions include depression, anxiety, and bipolar disorder. Management can involve therapy, medication, lifestyle changes, and support from friends and family.
What are some warning signs of a heart attack or stroke?
Warning signs of a heart attack include chest pain, shortness of breath, nausea, and sweating. Warning signs of a stroke include sudden numbness or weakness on one side of the body, difficulty speaking or understanding speech, and sudden severe headache.
What are some ways to manage chronic pain?
Management of chronic pain can involve a combination of medication, physical therapy, relaxation techniques, and lifestyle changes such as exercise and stress reduction.
How can people improve their overall mental health and well-being?
Some ways to improve overall mental health and well-being include getting regular exercise, practicing mindfulness or meditation, maintaining social connections, and seeking support when needed.
What are some common causes of insomnia, and how can it be treated?
Common causes of insomnia include stress, anxiety, depression, and poor sleep habits. Treatment can involve therapy, medication, and lifestyle changes such as creating a relaxing bedtime routine and avoiding caffeine and alcohol before bed.
How can people manage their stress levels?
Managing stress levels can involve techniques such as exercise, meditation, deep breathing, time management, and talking to a trusted friend or therapist.
What are some common causes of fatigue, and how can it be treated?
Common causes of fatigue include lack of sleep, stress, anemia, and certain medical conditions. Treatment can involve addressing the underlying cause, improving sleep habits, and making lifestyle changes such as improving nutrition and exercise habits.
What did you think about self-medications?
Self-medication is the practice of using medication or other remedies to treat a health problem without the guidance or supervision of a healthcare professional. This can include taking over-the-counter medications, using herbal remedies, or even using prescription drugs obtained from friends or family members. Self-medication can be a risky practice, as it may lead to incorrect self-diagnosis, inappropriate medication use, and potential harm from side effects or interactions with other medications. It is always advisable to seek professional medical advice before using any medication or treatment.
What are some common reasons why people self-medicate?
Some common reasons for self-medication include convenience, cost savings, lack of access to healthcare, and a belief that the condition is not serious enough to warrant professional treatment.
What are some potential dangers of self-medication?
The potential dangers of self-medication include misdiagnosis, incorrect dosages, adverse drug interactions, drug dependence, and addiction.
What should people do before considering self-medication?
Before considering self-medication, people should consult a healthcare provider to determine the cause of their symptoms and receive guidance on appropriate treatment options.
What are some conditions that should never be self-medicated?
Conditions that should never be self-medicated include serious infections, chronic conditions such as diabetes and heart disease, and mental health conditions such as depression and anxiety.
What are some common over-the-counter medications that people may use for self-medication?
Common over-the-counter medications that people may use for self-medication include pain relievers, antihistamines, and cough and cold remedies.
How can people ensure the safety and effectiveness of self-medication?
To ensure the safety and effectiveness of self-medication, people should carefully read and follow the instructions on the medication label, avoid mixing medications without consulting a healthcare provider, and be aware of potential side effects.
What are some signs that self-medication is not working and professional medical attention is needed?
Signs that self-medication is not working and professional medical attention is needed include worsening symptoms, persistent symptoms, and adverse reactions to medication.
What should people do if they experience adverse effects from self-medication?
If people experience adverse effects from self-medication, they stop taking the medication and seek medical attention immediately.
How can healthcare providers help prevent self-medication?
Healthcare providers can help prevent self-medication by educating patients on appropriate medication use, prescribing medications only when necessary, and monitoring patients for potential side effects or adverse reactions. What
is the importance of good hygiene?
Good hygiene is important for preventing the spread of germs and disease, maintaining overall health and well-being, and promoting social and personal confidence.
What are some basic hygiene practices that people should follow?
Basic hygiene practices include regular hand washing, brushing teeth twice a day, taking daily showers or baths, wearing clean clothes, and keeping living spaces clean and well-maintained.
How often should people wash their hands?
People should wash their hands frequently, especially before eating, after using the bathroom, and after coughing, sneezing, or blowing their nose.
What are some common sources of germs in the home?
Common sources of germs in the home include kitchen sponges, cutting boards, bathroom towels, and pet dishes.
How can people ensure that their food is safe to eat?
People can ensure that their food is safe to eat by following proper food handling and storage practices, washing fruits and vegetables thoroughly, and avoiding cross-contamination of raw and cooked foods.
What are some important hygiene practices for preventing the spread of respiratory illnesses?
Important hygiene practices for preventing the spread of respiratory illnesses include covering coughs and sneezes, avoiding close contact with sick people, and staying home when feeling ill.
How can people prevent the spread of infections in public places?
People can prevent the spread of infections in public places by practicing good hygiene, such as covering coughs and sneezes and washing hands frequently, and avoiding touching their face and other surfaces.
How can people maintain good oral hygiene?
People can maintain good oral hygiene by brushing their teeth twice a day, flossing daily, and visiting a dentist for regular checkups and cleanings.
What are some common causes of body odor, and how can it be prevented?
Common causes of body odor include sweat, bacteria, and certain medical conditions. Prevention can involve regular bathing, wearing clean clothes, and using antiperspirant or deodorant.
How can healthcare providers promote good hygiene practices among their patients?
Healthcare providers can promote good hygiene practices among their patients by educating them on proper hygiene techniques, demonstrating good hygiene practices themselves, and providing resources such as hand sanitizer and hygiene products.
So in conclusion, what is your final wording about general health?
I'd like to tell you some general guidelines that can help improve overall health, such as maintaining a balanced diet, engaging in regular physical activity, getting enough sleep, managing stress, avoiding smoking and excessive alcohol consumption, and staying up to date on recommended health screenings and checkups. Additionally, it is important to prioritize mental health and seek professional help.
Very informed discussion with you, Dr. Hope it is helpful for people. If you have any question about our discussion, feel free to write in comments. We try to give you answer. Thanks watching. If you like my video, please share and subscribe.